What I heard, Dr. Mill. The vaccine is a weapon developed by the military, specifically the one that is Operation Warp Speed. That's to take out black people and people of color because of overpopulation and depopulation of the Europeans. Dr. Mill, is that true?
No, that is not true.
No.
And see.
However, I can understand why we as black people have concerns about our government and its intentions to us. I mean, it goes back historically, and we don't even need to reiterate the Tuskegee experiment and forced sterilization and slavery and everything that our government has endorsed that has happened to us. And it also goes to currently the things that I've talked about, our own experiences with the healthcare system that have sometimes seemed to devalue us. So I get it. I get where it comes from. And then on top of that, you have the how the virus and the response to the virus and the development of the vaccine has been politicized by the current administration. You have the terrible name of Operation Warp Speed that implies speed over safety. I get all of that. But the thing to keep in mind is if the government doesn't need to develop something to kill us because the coronavirus is doing a great job all by itself. The death rate for African Americans is 3 times that of Caucasian Americans. So the government doesn't need to do anything else to help the coronavirus. The other thing is, yes, Operation Warp Speed funding did go to some companies to develop the vaccine. However, Pfizer did not take any Warp Speed money. And then finally, the speed within Warp Speed also is a misnomer because the work had predated the Trump administration by 10 years in terms of the platform that's being used to deliver the vaccine and the virus mRNA to the body. We talked about what mRNA was last week. It's the instructions that your cell gets from the virus to make more virus. M stands for messenger. So that messenger RNA is something that our own body makes within our cells to instruct our cells what to make in terms of what our own body needs, the proteins that our body needs. So messenger RNA is something that our body gets exposed to anyway. So all it being sort of the boogeyman in this as something that can kill us is actually ridiculous because it's something that if you get a regular virus infection, the cold has its own messenger RNA that it brings into your body when you get infected with the cold virus, and your body has its own messenger RNA, like I said. So it's not true at all that this
Okay.
was developed to kill us.